Today let us discuss about dengue. Know, prevent, act, heal early and naturally. Kuramjari Mayambu. Today let's talk about something that concerns us all, especially in the state of Manipur right at the present moment: dengue. Every year during the season we see more and more cases in our communities. But the good news is dengue can be prevented, and if managed properly, it can be overcome without complications. Manipur is currently facing a sharp surge in dengue infections, with over 2,300 confirmed cases reported this year and at least one death documented. Indianews.com.au+2 Tripura.net +2 health officials point to prolonged monsoon rains, clogged drainage and accumulation of stagnant water in the densely populated valley regions, especially in Imphal West and Imphal East districts, as contributing factors. Tripura.net +1 authorities have intensified vector control measures and awareness drives, but emphasize that community participation and household-level prevention remain critical to controlling the outbreak. This is not just the job of doctors or the health authorities alone. This is something each one of us can take part in. So let's learn together what dengue is, how it spreads, how to protect ourselves and our families, and how we can support our body naturally. What is dengue and how it spreads? Dengue is a viral infection caused by the dengue virus. It spreads through the bite of a particular mosquito called Aedes aegypti. This mosquito usually bites during the day, especially early morning and late afternoon. It breeds in clean, stagnant water, like water drums, coolers, flower pots, coconut shells, discarded tires, buckets, or even small bottle caps. It's important to understand, dengue does not spread directly from one person to another. It spreads through mosquitoes. So what can we do? First, make sure no clean water is left standing around your house. Empty and clean water containers at least every 2 to 3 days. Cover all stored water properly. Wear long-sleeved clothes, use mosquito nets and screens. Use natural repellents like neem oil, citronella, lemongrass. Grow mosquito-repelling plants like tulsi or marigold around your homes. Keeping your surroundings clean and dry is one of the strongest weapons against dengue. If you live in a place where dengue is common, then you must be alert during the dengue season. Any case of fever should immediately be suspected as dengue until proven otherwise. Take care of your immunity. Good food, good sleep, hydration, and regular sunlight exposure. And most importantly, community effort is essential. If one household is clean but the neighbor isn't, the mosquitoes will still be there, so everyone must participate. The symptoms often begin suddenly. Watch out for high fever, often 104 degrees Fahrenheit or more, headache, pain behind the eyes, severe joint or muscle pain, often called break bone fever, skin rash, nausea, vomiting, tiredness. If there is persistent vomiting, bleeding from gums or nose, blood in vomit or stool, severe abdominal pain, restlessness, or breathing difficulty, go to the hospital immediately. When to test and when to go to hospital. If you have fever, it's good to get tested early. Day 1 to 3, NS1 antigen test. Day 5 onwards, IMG and IgG antibody tests. If you or someone you know develops warning signs or rapid platelet fall, don't wait. Seek hospital care. No antiviral or unnecessary antibiotics. One very important message: there is no specific antiviral drug for dengue. And because dengue is caused by a virus, antibiotics do not help. Please avoid self-medicating or taking unnecessary tablets. Paracetamol may be used for fever, but avoid painkillers like ibuprofen or aspirin as they can increase bleeding risk. Unnecessary medicines can sometimes do more harm than good. What happens in the body? The virus mainly affects our blood vessels and platelets. It can make them fragile, leading to fluid leakage, low platelet count, and sometimes bleeding. Remember, complications often appear when the fever starts to come down, usually between day 3 and 6. So that is the most crucial period to watch closely. Natural support and prevention. Along with medical care, we can support our body naturally. Stay well hydrated. Drink water, ORS, soups, juices, coconut water. Papaya leaf juice, around 5 to 10 milliliters twice daily, may support platelets. Giloy, Tinospora cordifolia, helps boost immunity. Tulsi leaves, natural antiviral and calming. Guava leaf tea or fresh guava, rich in vitamin C. Turmeric water, anti-inflammatory support. Adequate rest and gentle sunlight exposure help the body recover faster. These natural supports are not a substitute for hospital care if warning signs appear, but they can help the body fight better in mild cases. Emotional calm and healing. Another important point that is often ignored: mental state matters. When we panic, stress hormones rise, and this can actually weaken our immune system. So patients and families should stay cool and calm, practice deep breathing, prayer, or light meditation. Reassure the patient. Most dengue cases recover well with good care and hydration. Fogging, not a real solution. Many people think fogging alone will solve the problem, but the truth is, fogging only kills the adult mosquitoes that are flying at that moment. It does not kill the larvae, which will grow into adult mosquitoes in a few days. If doors and windows are open, fogging can even drive mosquitoes into the house. Also, the dengue virus can be transmitted from adult mosquitoes to their eggs, and when these eggs hatch, the infection cycle continues. So fogging is only temporary. The real solution is to remove breeding sites. Community action and responsibility. Friends, dengue cannot be controlled by the government or health authorities alone. They can fog, they can test, they can treat. But if we don't clean our homes and surroundings, mosquitoes will keep coming back. True dengue prevention starts in every home, every lane, and every community. Community cleanup drives, regular emptying of containers, covering tanks, proper disposal of waste, and active reporting of fever clusters are powerful community tools. Closing message, firm but reassuring. So, to sum it up, dengue is preventable. There is no specific antiviral drug, no antibiotics needed. Natural remedies and good hydration can support healing. Stay calm. Anxiety can make the body weaker. Fogging is not enough. Real prevention is eliminating mosquito breeding. This is not just the job of the government. This is our responsibility as a community. If we work together, clean surroundings, early suspicion of fever, calm and correct care, we can protect our families and stop dengue. Thank you for listening with an open heart. Let's keep our homes clean, our minds calm, and our community united. Dengue can be stopped, but only if we all act together. Your wellness is our pleasure. Holistic Wellness Foundation, IMFAL, merging modern science with timeless healing wisdom.